mynews.studio.
A single drop of blood could soon reveal the secrets of Alzheimer's. Do you think this might completely change the way we understand and manage dementia?
Today's date is June 9th, 2025. Let's get to the basics first. What is this new blood test for Alzheimer's, and why is everyone talking about it?
Just last month, the FDA approved the LumaPulse G-p-tau 217/amyloid 1:42 plasma ratio test. It's a blood test designed to detect amyloid plaques in adults over 55 who are showing signs of cognitive decline. The thing is, until now, diagnosis relied on PET scans or spinal taps, both expensive and invasive. This blood test offers similar accuracy, over 90% agreement with those older methods, but all it takes is a simple blood draw.
So instead of needing a spinal tap or a brain scan, you just have to give a vial of blood.
Exactly. For decades, families and doctors have often waited weeks or months for a definitive diagnosis. This test could deliver results much faster and with less stress. That's important because earlier answers can lead to earlier intervention.
Let me check the numbers for a moment. Dementia affects over 55 million people worldwide, right? And with aging populations, that number could double by 2050. How does a blood test change the landscape globally?
The main advantage is accessibility. Blood tests can be done in so many more places: rural clinics, community hospitals, even mobile health units. PET scans, on the other hand, need specialized equipment and trained staff. So this isn't just a benefit for people in big cities or wealthy regions.
And what about the cost? PET scans are notoriously expensive.
Blood tests are much more affordable and don't require as many resources. That could lower costs for health systems and make screening available to more people. There's another benefit, too. The test can help doctors stage the disease by measuring tau protein aggregates, which means treatment can be better matched to how far the disease has progressed.
So if doctors know the exact stage, does that mean treatments can be more targeted?
That's the goal. Staging the disease through a blood sample allows clinicians to choose interventions that fit each patient's situation. It also has big implications for research, making it easier to enroll the right participants in clinical trials and hopefully speed up drug development.
But at this point, the test is approved just for people with symptoms and mostly in specialized care settings. Right? What about people who aren't showing symptoms yet?
That's where research is headed next. Teams are already working to see if the test is accurate for people without symptoms. The hope is that, in the future, we'll be able to catch the disease even earlier, maybe even before memory problems begin.
And insurance? Now that the FDA has approved the test, does that mean people in the US will be able to get it covered soon?
FDA approval is a big milestone, but insurance coverage and broader rollout take time. For now, the test will probably be available first in higher-income countries and established medical systems. Expanding access to lower-resource settings will require more data and adaptation.
What does this mean for families? For a long time, getting a diagnosis has meant uncertainty and long waits. Does this change that experience?
It really could. A faster and more accurate diagnosis means families can plan, get support, and start treatment sooner. That can have a big impact on quality of life for both patients and caregivers.
Are there any risks or things we don't know yet? No test is perfect.
That's true. While the test matches up well with current gold standards, it's not perfect. Clinical judgment is still important, and ongoing research will keep refining how and when the test should be used.
So to sum up, one blood test could transform Alzheimer's diagnosis, making it earlier, easier, and available to more people. That affects patients, families, doctors, and health systems everywhere.
Right, it's a hopeful moment for millions, and a reminder of how innovation can push global health forward.
Thank you for listening. This episode was powered by mynews.studio. Give it a try for free.